appreciate all for this presentation. And I'll talk about the answer or answers to this question. Why do you use the Ferrara ring? And there are actually five answers for this question. First, the fact. Second, the nomogram. Third, the long-term follow-up. Four, the yellow filter. And five, the published studies. First, a fact. The Blavatsky's law was described, and this law described the mechanism of action of the intercorneal ring segments. And we know that the larger the diameter of the ring, the lesser the correction, and the thicker the ring, the greater the correction. So, using a ring of small optical zone, as the Ferrara ring that has a 5 mm optical zone, you usually have a more flattening effect and more correction in astigmatism correct, and more myopia in astigmatism correction. The second point would be the Ferrara ring nomogram. There is a continuous evolution of the nomogram, and in the first generation of the nomogram, only the keratoconus grade was considered for the ring selection, and it showed to be very unpredictable. So it was moved to the second generation that was based on the spherical equivalent, and then for the topographic astigmatism and the actual nomogram that is based on the corneal sphericity. The second generation of the nomogram from 2002 to 2006 was based on the spherical equivalent. These eyes are completely different because in the first case the high myopia is actual. So you should not make the same surgical plan for these two different cases. Then we move forward for the third generation of the nomogram that was based on the topographic astigmatism. But when you compare this eye number 1 with 5 diopters of astigmatism with the eye number 2 with the same 5 diopters of astigmatism but with completely different corneas, if you make the same surgical plan, the results will be not the same. For that reason, we move for the nomogram based on the corneal sphericity. We know that the corneal sphericity is related to the corneal shape, and it can vary from oblate, in which the center of the cornea is flattened at the periphery, to prolate, in which the center of the cornea is steepened in the periphery. In the keratoconus corneas usually are hyperprolate, and the normal cornea is mildprolate. It has been established the normal Q value or normal value for sphericity as minus 0.23, and it is very important to have this value in mind because this is going to be our target Q value after the ring implantation. So the corneal sphericity ranges from oblate, in which the Q value is positive or 0. In more advanced cases of keratoconus, the Q value is more negative, the cornea is more prolate.